changes in weight associated with lupus. So we know that people may gain weight because of certain medications or changes in lifestyle, or perhaps sometimes because of disease characteristics. So the first question that we've got on this topic, someone has asked whether it's true that people with lupus gain weight more easily than other people, because they've expressed that they have to really fight to lose weight since they were diagnosed with lupus, and previously they were always very slim.
So it's definitely not a surprise that, if you're suffering with lupus, then you would have trouble losing weight, and you seem to gain weight more easily because lupus is associated with having high inflammation in the body. And it is known that when we have high inflammation in the body, it actually makes it very, very difficult for us to lose weight and to burn. The other thing about lupus and other autoimmune conditions is that they are associated with having dysbiosis. That is, with having an imbalance in the gut bacteria. And actually having more, let's say, of this poor gut bacteria rather than the health-promoting gut bacteria, which can cause something called leaky gut. And when we have leaky gut, that is what kind of is associated with having more inflammation in the body, and it also causes the metabolism to not work as effectively as it otherwise would. So that is why, kind of using these lifestyle interventions to try and heal the leaky gut, to try and change the gut bacteria populations to more healthful populations, to reduce that inflammation, that can be a way to make weight loss in particular, along with a general health benefit, more attainable for patients.
Excellent. Thank you ever so much for that explanation. So the next couple of questions were around steroids, which we know many people with lupus are prescribed as part of their treatment. And a couple of people have expressed that they've put on a lot of weight as a result of taking steroids. So they've asked, are there any tips for losing weight, or at least not putting on as much weight when they're on a high dose of steroids?
Okay, so it's a fact that prolonged steroid use can increase your appetite and promote weight gain. And apparently those two can lead in weight gain. So how can you tackle this? I would say, number one, hydrate. And note that not all drinks hydrate you. For example, caffeinated drinks and alcoholic drinks do not hydrate you. So, just invest in decaffeinated drinks and cut down on alcohol, which is generally advisable. Then exercise as much as you can, as much as it is easy and convenient and comfortable for you. Cut down on salt, replace it with herbs and spices. Keep in mind that foods naturally contain sodium, so cutting down on salt would be the best thing that you can do. Notice that, it's important to know whether you eat for emotional reasons sometimes. So notice that if you eat for emotional reasons, if the answer is yes, then do try to cope with stress. For example, talk to a friend, find a psychologist that you can trust, practice yoga or meditation, exercise, find a list of things that can help you reduce tension so that you will not overeat because of emotional reasons. And regarding diet, I would say the easiest thing to do is to make the right swaps. For example, choose fresh fruit and vegetables instead of juices or dried fruit, unsweetened and unsalted products instead of sweetened products and sugary products. Choose low-fat dairy. Label checking can help you very much in this process, and bear in mind that words such as syrup, dextrose, caramel, lactose, saccharin, sucrose are all synonyms of sugar. So you may need to avoid this.
Excellent. Thank you. So the next question is sort of from the other end of the spectrum, where there's someone who they're underweight. They have lupus and ILD, pulmonary fibrosis, and they've lost a lot of weight. And they eat all the healthy things that they've mentioned, but they also say they suffer from GORD. So what could they eat to help them maintain a healthy body weight?
Right. So this is actually a pretty tough one, definitely, because these conditions they kind of increase the metabolism. They do make it very difficult to put on weight. A healthy replacements that I could say, usually you would tell people to eat a little bit of these and not too much, but to someone who wants to put on weight, nut butters, I think, are a great replacement. I know that if you have a little bit of GERD, maybe having too much is going to make, the GERD a little bit worse. But again, if you're having kind of portioning it out over the course of several meals and just making sure that you're getting a lot of healthy fats in there from the point of view of nuts, and all different kind of nuts are great ones. Avocados are also a really great one. So I would focus more when trying to gain weight on trying to get a lot of those healthy fats in. And because in terms of the calories, they don't have as much of the fiber and the water that is going to fill you up very quickly. And so you're going to be able to get bigger quantities of that and more of the calories, as well as getting the anti-inflammatory benefits and the good fats.